I think it's the use of video contact with remote areas, to me, is a very exciting thing to be doing. I'm not clear in my mind how much I should be talking and how much I should be listening to the people in Valemount. And I think I still have a little bit of a tendency to talk too much and turn it into too much of a lecture without hearing the concerns that are being voiced. But as against that, in a group, sometimes people don't voice their concerns.
We often treat patients with COPD basically palliatively. And now we have the opportunity to come up with new ideas and to keep going with these groups of people, keep motivating them, keep getting newer ideas and the newer kind of information directly from the specialist. You know, nowadays we have a lot of patients that go onto the internet and get their own information, and it's not necessarily the right information. So it helps a lot if you have all these patients in one group and you have a specialist in that area that can give us the newest up-to-date information and help us to just guide the group into a specific direction. Otherwise, we would have seen these patients one-on-one, and motivation of these people can be really difficult. So I've heard Dr. Smith say that he thinks he's talking too much, but I think that is so essential in these groups to keep on giving information and motivating these people. And like Lisa said, they have to travel for 300 kilometers if they want to see a specialist in Prince George. And for them it can be difficult to get onto a bus. If they can't go with the bus, it can be difficult to get somebody to drive them there, because a lot of our people in this community are older people and they don't necessarily have family here that can drive them. So this is an amazing way out of that problem for us.
We're not the most isolated rural community by any means. It's still 300 kilometres to Prince George, or 330 to Kamloops, or 500 odd to Edmonton would be our main kind of referral centres. But you know, for our patients, especially on winter roads, if they get referred to a specialist, at that stage they had no option but they go to travel to see the specialist, and they come home and the specialist orders some test or something like that. So they travel again to get the test, and then they come home again, and then they travel again to get the results of the test for a 5-minute appointment, and then come home again. And it's just really, I think it's a huge privilege for us to kind of be involved with shared care and have this shared care initiative kind of growing out of trying to look at addressing those issues. And I mean, where we are now, we even see some practical kind of changes to that. And it's just, I'm really excited to see where it's going to go.